Our first speaker, many of you know who he is. This is Jeff Levinson. Jeff has been a practicing Manhattan dentist for 43 years. He serves as co-president of the APBD Research Foundation. He has been dedicated to its mission since its founding shortly after the loss of his father and uncle due to the ravages of APBD. Under his leadership, the foundation has reached key milestones, including developing laboratory models, tissue collection, advancing registries and natural history studies, facilitating the collaboration of critical academic, allied disease foundation, and pharmaceutical partnerships, being selected as a grantee in the Chan Zuckerberg Initiative Rare as One program, which has been critical toward expanding the APBD Research Foundation team. You're going to hear from many of those folks today. Jeff's efforts have been instrumental in driving the foundation's progress and impact, and he continues his efforts to broaden awareness about GSD4, including APBD and other allied diseases. Jeff, take it away.
It is my privilege, along with founder and co-president Emil Weiss, to welcome each of you to the 2024 APBD Scientific and Community Conference. On behalf of the APBD Research Foundation's leadership, staff, and our conference planning committee, thank you for joining us today. We are thrilled to have a record number of conference registrants contributing your voices as researchers, healthcare providers, industry partners, nonprofit, and government representatives, and people whose lives have been directly impacted by GSD4, including APBD and other allied diseases. We are thankful to have you join us from across North and South America, Europe, and Asia. We look forward to spending the next 2 days with you, exploring further our individual and collective roles in making treatments a reality for individuals, families impacted by APBD and allied diseases. I'm very excited about the breadth and depth of this year's conference. I'd like to thank our conference sponsors for their support to bring our community together in this format. We could not do it without you. Where would we be without Calliope Glarus, founder of Philanthropy Without Borders, and her team, whom we have worked with for many years and who are managing our conference today? I'd also like to acknowledge the Foundation's Board of Directors and our staff, Natasha Piris, Jim Meyer, Sharon Steinberg, Anessa Katazovich, and Rebecca Reif, our new science coordinator. Together, they have brought a high degree of professionalism and dedication to the grueling work to find therapies for rare diseases. Quite frankly, I had no idea what this journey would involve when, together with Dr. Edwin Kolodny and the Weiss family, we started the foundation in 2005. Every time we enter a new phase of drug development, or there's a new finding, the challenges and possibilities begin anew. For example, the soon-to-be published finding by the Broad Institute's Rare Genome Project that the number of individuals with GBE1 diseases, APBD and all other GSD4 phenotypes included, is estimated at 26,000 individuals globally. What would be the implications if we can identify even 10% of those individuals? We've been very fortunate to have the support of the Chan Zuckerberg Initiative, Faster Cures, Beacon for Rare Diseases, which, among many other contributions, provided exceptional mentors like Sue Kahn and Helen Hernandez to help us navigate the transitions and prioritize the new challenges. Additionally, we thank the many other foundation partners that help sustain the many facets of our work and drive our progress. Thanks to a recommendation from Beacon for Rare Diseases, we recently applied for and received a grant from Costello Medical. We began work early this month with the Costello Medical team on a strategic communications plan to maximize outreach to and collaboration with other GSD4 community stakeholders. This work builds on our recent APBD and GSD4 focus group, facilitated by Dr. Vanessa Ferreira and her Portugal-based Humanized Solutions team. Once again, for the ninth consecutive year, we've participated in Penn Medical's Orphan Disease Center $1 Million Bike Ride supporting APBD research. Since 2016, we have raised over $870,000 for APBD research via this program. Several of the research updates you will hear about today and tomorrow were supported by pilot grants from the MDBR program. We are very excited about the revitalization of our Scientific and Medical Advisory Board, thanks to the leadership of Dr. Jennifer Orthman Murphy and Dr. Felix Nitschke. We also extend a big thank you to our academic researchers and the institutions with which we are associated, including Columbia University, NYU Langone Health, UT Southwestern, Duke University, University of Florida, University of Pennsylvania, Tel Aviv University, Newcastle University, Hadassah University Medical Center, and others. Recognizing that our strength is in numbers, we want to thank the many other allied disease foundations representing GSDs, Lafora disease, Pompe disease, as well as several umbrella rare disease organizations that have entered strategic collaborations with us. Finally, our gratitude to our patient community and the family members has no bounds. It is you who since 2005 have helped the APBD Research Foundation fund more than $1 million in research grants to many of these institutions. The role that each of you plays in our community has enabled the progress we have made. We will continue to need each of you as we strive to realize our vision of a life free of APBD. We believe that not one more person should suffer from APBD and allied diseases, and that by working together, treatments are within reach. We are thankful to all of you here today for your extraordinary support and outstanding contributions to our cause. It has been said that the purpose of life is a life of purpose. By our involvement in this foundation, in working to find therapies and a cure for APBD and allied diseases, we are making a difference. We are leading purposeful, impactful lives. Thank you.